All right. Good morning, everyone. My name is TJ Sartiano. I am the sales manager for Blue Cross Blue Shield Federal Employee Program here in Florida. It is my pleasure to be speaking to you this morning. And thank you, Bill, and the team for setting this up. We were talking earlier about the weather. As you can see in this picture, it looks like the folks are appropriately dressed for the weather today. I'm going to take some time to go over the 2023 benefits, some of the changes, and some important information for all of our NARF folks. I've been doing this a long time with Bill and with NARF. I just had an opportunity to speak at the state convention. And the Federal Employee Program is near and dear to my heart as I am the son of a federal employee. So as you know, for over 60 years, Blue Cross Blue Shield has been working with federal employees, retirees, and their families. We are the #1 health insurance choice for federal employees, retirees, and their families. 99% of our members continue to choose to stay with us year after year, and it's something we're very proud of. In Florida, we too are the #1 healthcare provider for federal employees, retirees, and their families. 75% of all retirees have a Blue Cross Blue Shield card in their pocket, so that means 3 out of 4 of you probably have Blue Cross. And that coverage covers you not only in the US, but worldwide. So whether you're in Athens, Florida, or Athens, Greece, your Blue Cross Blue Shield coverage will travel with you. I mentioned that 99.6 retention rate. That means year after year, people love Blue Cross and they continue to stay with us. And actually last year, we increased our market share in Florida. So that's good news. Let's talk about our coverage. So we have 3 plans designed to fit every need in every budget: Blue Focus, Basic Option, and Standard Option. Standard Option is the most popular plan among all federal employees and retirees worldwide. But for the past 15 years, more federal employees and retirees have chosen Basic Option as their plan of choice. And to be honest with you, I'm for finding the right plan for you, whether that's a Blue Cross plan or somebody else. If you're in the right plan, then that's the right plan for you. So you may be thinking about, well, which plan is the right plan for me? A couple things to consider. How are you currently utilizing your benefits? You know, do you go to the doctor once a year, or do you go to the doctor 12 times a year? Do you have any planned procedures coming up, any surgeries? Are you taking any prescription drugs? Maybe you're just taking a few generics, or maybe you have a chronic condition where you're taking multiple medications. I always encourage our federal employees and retirees to ask your doctor or provider about which carrier works best with them. We all know that claims can be a hassle, and we don't want people having to deal with claims. A lot of that comes with a lot of turnover at a doctor's office or a hospital. So we really encourage our retirees to speak to their doctor about their provider of choice. We have a large network. Over 96% of all of our hospitals and 95% of all the doctors in the US are part of our network. And we have over 55,000 retail pharmacies. So when I speak to pharmacies, retail pharmacies, that's going to be your CVS, your Publix, your Winn-Dixie, your local in-town pharmacy. And remember, whether you're in Blue Focus, Basic Option, or Standard Option, you have access to the same network of preferred providers and hospitals. And for some of those in Pinellas and Hillsborough County, we just signed a multi-year contract with BayCare. So we're very happy with that. We were in negotiations a few months ago, and we came to an agreement with the BayCare system, and we have a multi-year contract in place. Remember, with all our plans, you're going to receive free preventative care from preferred providers. No referrals, and that's big. If you have to go see an endocrinologist or a urologist or any of those IST doctors, you can just go see them. You don't need a referral from your primary care. As I mentioned, your coverage, you're covered whether you're in the US or overseas as well. And all of our plans have some type of wellness reward and discount associated with them. Blue Focus is a product that we introduced a couple of years ago, specifically designed for those individuals that are living a healthy lifestyle. They don't take prescription drugs. If they do, it's maybe one generic. The premiums are lower, but this plan was specifically designed for, and I'll give you an example. I was at a Social Security office and a 25-year-old kid came up and said, which plan's best for me? So of course I asked him, well, how do you utilize your benefits? And he says, well, I haven't been to the doctor in 4 years. Blue Focus is probably the best plan for him. It's going to give him some of that core coverage as far as going to the doctor, but he would pay more out of pocket if he had a chronic condition. And for folks that are utilizing their benefits, this is really an entry product for those new federal employees. As I said, basic option is, for the past 15 years, has been the #1 choice among federal employees and retirees. You have that in-network care, you have preferred and non-preferred drug coverage. All your out-of-pocket costs are covered with Medicare A and B. There's no deductible. And remember, 85% of federal retirees in Florida choose Medicare A and B. Your federal plan was designed that you take it into retirement and combine it with Medicare A and B. Basic option also has a Part B Medicare reimbursement of $800. So if you have basic option and you have Medicare A and B, each person on the contract can receive up to $800 to offset your Part B premiums. That money will come directly to you. You can use that to, put it in your checking account and offset your premiums. We had one couple who both received $800, so they had $1,600. They went on a cruise with that money. We have other people that buy new TVs because it's football season. I've got a little icon there of a volcano exploding. That's sort of my head. And the reason being is this. For those basic option members that can get that $800 in Florida, 18,000 of you have yet to claim that money. That equates to over $14 million of retirees in Florida that have basic option that have not claimed their Medicare reimbursement. So I want to make sure that if you have Medicare A and B and basic option and you're retired, you are getting your $800 per person on the contract. Now, standard option is the most popular plan among all federal employees and retirees worldwide. More people have this plan than any other plan in the entire federal employee health benefits program. It gives that flexible coverage where you can go in and out of network. It also has preferred and non-preferred drug coverage, access to mail service pharmacy, and we have a generic incentive program, which I'll cover here shortly. So let's talk about the benefits. Remember, when you have Medicare A and B, and you combine that with your federal plan, Blue Cross Blue Shield picks up all your co-pays and your co-insurance. The only thing you're going to be paying out of pocket for is going to be your prescriptions. So I always tell people, most of our retirees have obviously basic option or standard option. If you have Medicare A and B and you receive a bill from us, not from us, but from your provider, something's wrong. You do need to call us because you should not be receiving a bill if you go to an in-network doctor or hospital, and you have Medicare A and B. So whether that's inpatient hospital, outpatient hospital, surgery, you pay nothing out of pocket with your Blue Cross Blue Shield plan. And Bill is recording this session, so I don't want to spend too much time on each slide because you can review it later. But the main point here is no out-of-pocket cost when you combine Medicare A and B with your basic option, your standard option, or your Blue Focus plan. Deductibles are paid for as well by your plan. So your insurance kicks in January 1, and you don't have any deductibles to meet or anything like that. Our out-of-pocket maximums did not change from last year. They stayed the same. I know some of the other carriers out there increased their out-of-pocket maximums. We did not, so all of that stays the same. Premiums. As you know, federal employees get their premiums taken out of their allotment monthly. I was reading an article, I think it was on Government Exec, or it was on Fed Soup or one of those, where premiums for all the carriers in the Federal Employee Health Benefits Program went up about 7.5%. We did have an increase across all of our products. That increase on average was 6%. So we were a little less than the average increase for all the carriers. So we're excited about that going into 2023. But let's talk about what's new. So if you have Blue Cross, as many of you do, you want to know what's new for 2023. Under our health and wellness, I talked about that Blue Focus product specifically designed for those individuals living a healthy lifestyle. If you have Blue Focus, most, I would say 99% of our retirees have basic option or standard option. But if you did have Blue Focus, when you go get your annual physical, we are going to pay you $150 on your My Blue Wellness card just for getting your annual physical. For our basic option members, now you can get 12 covered acupuncture visits a year as opposed to 10. So we increased the number of acupuncture visits that you can get throughout the year. We did lower the age where we will begin covering weight loss surgery for members to 16. And we removed the limit on covered non-sibling donors for transplant services. So these were the three big medical benefits that we changed. For our pharmacy, we added 4 new drug classes to the standard option generic incentive program, which I'll go over on the next slide. We also lowered the cost for insulin. For our diabetic patients out there, we know that's a huge expense. We were able to lower our preferred insulin cost. We now cover approved weight loss drugs to treat obesity through the pharmacy program. Now, there was an increase on basic option tier 1, 2, and 3 drug costs. So remember, your copays, your coinsurance, your deductibles are all paid for. The only thing you're going to be responsible for is your pharmacy prescription drugs, but your generic drugs stayed at $10. So generic drugs stay at just a flat $10 copay. I mentioned that standard option change to the generic incentive program. So here's how that works. If you have standard option and your doctor prescribes a brand name drug like Wellbutrin, if you go to the pharmacy and you ask for the generic version of Wellbutrin or any other brand name, we are going to pick up your first 4 generic refills for free. So for those of you that have standard option that are taking a brand name drug and generic works for you, when you switch to the generic, you're going to get your first 4 refills for free. For our pharmacy, I talked earlier about that 55,000 retail pharmacies. That's going to be, your CVS, your Publix, your Winn-Dixie, or maybe just the local pharmacy in your town. We also have a mail order pharmacy where it allows you to get 90-day supply of your medicine sent directly to your home. That's for standard option members or basic option members that have Part B. So if you have Part B, you're eligible for mail service pharmacy as well. And then we have a specialty pharmacy program. So this specialty pharmacy is really if you have a chronic condition such as cancer, maybe COPD. A lot of times they need to be refrigerated. A lot of times these are the type of drugs that you see on TV. All of those commercials typically fall under the specialty drug program a lot of the times. As I said, your cost for your generic, your tier ones for basic option is only $10. For standard option, it's a $7.50 copay. When we get into some of these mail service where we ship them directly to your house, there is a huge discount. I was actually at the state convention. I met with a member who was taking a drug called Farxiga. If you go to the pharmacy and get Farxiga, retail cost is $1,463. She uses the mail service pharmacy program, and her cost is only $40 a month. So huge savings there. For our specialty pharmacy cost shares, once again, these drugs are very, very expensive. We looked at a drug, I think it was Humira or something similar to that, where the retail cost was about $7,800 at the pharmacy. So if you just walked into the pharmacy and you wanted to get, I believe it was Humira, it's about $7,800. Under our program, you're only going to pay $85 for that $7,000 a month drug. You're only going to pay $85. So a huge savings there for our members as well. As we start talking about our wellness programs, we want to make sure all of our members have access not only to care, but to programs that help them with their health. So if you have hypertension, you can get a free blood pressure unit sent to your home at no cost. And the way we do that is we look at claims. A claim will trigger if someone has hypertension, and a blood pressure unit is available for them, and we ship that directly to their house. We also have a tobacco cessation program. So if you are interested in quitting smoking and tobacco, we have a free program where we cover all of the drugs needed to help you quit. Diabetes management, a huge cost for our members. One of the ways that Blue Cross is working to help our members is we now will give you, if you have diabetes, a free glucometer, unlimited test strips, and lancets, and you also get a diabetes coach to work with you. We know diabetes drugs typically are very expensive, not only the insulin, but the lancets and the test strips. Those glucometers, test strips, and lancets that you typically would pay out of pocket for are now covered under the plan as well. For those folks that have diabetes, if you submit your A1C results to us, and then later in the year, your results are good, we're going to reward you for that, and we're going to give you $75 for lowering your A1C results. We also offer Teledoc. Teledoc became very popular during COVID. So Teledoc gives you the opportunity to speak with a board-certified doctor in the state of Florida, and that doctor can actually write a prescription for you, and you can pick it up at the pharmacy all over the phone. So you don't need to go into a doctor's office to get a prescription. Typically, these are things like, you wake up with, maybe you have a cold and that turns into bronchitis or bad chest congestion, or maybe you have a rash or a fever. You can pick up the phone, talk to a teledoc doctor here in the state of Florida, and that doctor can actually write you a prescription where you pick up at the pharmacy. As I said, you don't need to go into the doctor's office. And we also cover nutritional counseling for free under the teledoc program. So if you're interested in changing your diet and you'd like to speak to a counselor, you can do that for free as well with our plan. Care management programs. These are a lot of, some of these programs people do not utilize, and they're very important. So we have care management programs to help members who are managing their complex health issues. It doesn't cost anything. And I'll give you an example of how this works. So we had a member whose spouse needed a liver transplant in the Tampa area. They lived in North Florida and were concerned because they understood that their spouse would probably be in the Tampa area for about 2 weeks with this transplant. They were concerned of the cost of having to get a hotel room in Tampa. After speaking with one of our care managers, the care manager let the spouse know that they have, with their Blue Cross Blue Shield plan, a transplant incentive where we picked up their entire hotel stay for the spouse. All things that come as part of your Blue Cross Blue Shield plan. Now, we also have a 24/7 nurse line that's free. So, maybe you wake up in the middle of the night and you've got a fever. You don't want to go to the emergency room because it's not that bad, but you are concerned. You can pick up the phone day or night and speak to one of our nurses, and that nurse will ask you a number of specific questions on how you're feeling, and they will give you advice on maybe, hey, take 2 Tylenol, give me a call back in an hour, we'll take your temperature again, let's see where that is. In some cases, that nurse may say, based on what you're telling me, in the morning, you really need to go to an urgent care facility to get yourself checked out. Or that nurse may say, based on what you're telling me, you might need to go to the emergency room. So you can speak with a professional at no cost, day or night. Some of our tools and resources. It all really starts at our website at FEHBP.org. It's the public website where you can find out about our plan. One of the first things that we ask our members to do is get started with MyBlue. This is going to be your personal login. It's going to show all the wellness incentives that you have accumulated. You have ID cards on your MyBlue account. So if you need to print ID cards yourself, you can do so. It also has a financial dashboard that's going to show all of your claims. We encourage all of our members to take a Blue Health Assessment. This is a personalized action plan where you go in. It takes about 10 minutes. You answer a few questions about your health, and you will receive $50 for taking the BHA. You can do that every single year. We have some members that have over $400 on their MyBlue Wellness card. And you can use that card, if you go to pick up a prescription and it's $10, you can use that to pay for that prescription. Or if you want to go to the dentist or to the eye doctor, you can use this money to offset, you don't have to pull money out of your pocket. You can use your MyBlue card for that. We also have an app. If you're into technology like Bill is, you have an app where, very similar to the website, you have your digital ID card right on your phone, direct links to the nurse line and teledoc. You can find a provider on your phone, and you can keep track of any out-of-pocket costs that you may have. I talked earlier about finding the right plan. If you're unsure which plan is the best plan for you, you can go to FEHBP.org and use the Ask Blue tool. The Ask Blue tool has some simple questions that you'll answer, and it will automatically recommend the best plan based on your needs at that time. So if you're in standard option and not sure whether basic option is the right plan for you, you can go to FEHBP.org, Ask Blue, answer a few questions, and it will make a recommendation on the plan that best fits your needs. We also have the Provider Finder tool, which I said, both on the app and on the website. So you can go in and you can type in either a zip code or the doctor name or the hospital. It'll tell you how far it is from your house. It'll tell you whether it's in network or not. Remember, you never need a referral for a specialist. So if you're looking up a specialist and they show on the app or they show on the Provider Finder, you can just make an appointment and go there. One of the changes in the law last year was the No Surprises Act. The No Surprises Act basically says that members of a health insurance plan should be able to know what their costs are before they go. So you can get cost information on our website. So if you're going in for a scheduled surgery, an MRI, a doctor's visit, whatever it may be, it will estimate any out-of-pocket costs that you will have. We have a prescription drug cost tool as well, all available on the website. I really like this tool, and here's why. So if you're in standard option and you're thinking of switching to basic option, it allows you to look up all of your medications that you're taking. It shows not only what you're currently paying in standard option, but it will show what your costs would be if you move to basic option. Also, if you're in basic option, it will show what your costs would be if you choose standard option. Now, don't forget, Blue Cross Blue Shield also offers dental and vision for our members. For our dental coverage, you pay nothing for your exams, your cleanings, and your x-rays. For your Class B services, such as oral surgeries, fillings, or gum scaling, depending on which plan you choose, and we have two plans, high option and standard option. So under high option, you wouldn't pay anything for your cleanings or your exams. If you needed a filling, Blue Cross would pay 70% of those charges. You would only pay 30%. And for those major services such as crowns, bridges, implants, root canals, and dentures, Blue Cross picks up 50% of those costs as well. These Class C services could be expensive. So years ago, I bit into a hamburger. It had a piece of bone in it. It cracked my tooth. Well, when you crack your tooth, I needed a root canal and a crown. Very expensive. We're talking $4,000 at least. Luckily, I have Blue Cross Dental, and Blue Cross Dental picked up half of all the charges to get my root canal and my crown. We do offer orthodontic services for both adults and children, and you get up to a $3,500 lifetime maximum per person for your braces. There is no deductible when you go in network to the dentist, so you just start day one, January 1, your benefits start. And I always recommend high option for folks that really are going to be utilizing the benefits. And the reason why is this: high option in network, there's no benefit limit. So if you know you're going to have what I call a bad mouth year, maybe you need some implants, maybe you need a root canal and a crown, Blue Cross Blue Shield is not going to limit the amount of work you can get done in that year. Most plans, including our standard option plan, may limit you to $1,500 a year. And after $1,500 a year, you're responsible for the rest of those costs. But if you know that you're going to have a bad mouth year, maybe dentures, implants, etc., we really recommend high option because there's no limit to the amount of dollars you're going to spend. We had one member that spent $40,000 in dental work in 1 year, and she was very happy that she had our high option. Here are the premiums for high option. Remember, you're paying this monthly. Most of Florida, except the Miami area, is in rating area 1. So we're very lucky in Florida. We have the lowest cost rating area as number 1. And in Miami area is rating 2. So for self-only, that would be, I'm just insuring me, my monthly cost would be $39.04. And then we also have coverage for you and your spouse or you and your entire family. Standard option is a little bit less expensive. That rating area 1 for self-only, just me, is only $19.91. We also offer vision insurance as well. Here we have 2 options, high option and standard option. You pay nothing for your exam. You get free spectacle lenses each year under our plan. For high option, you don't pay anything. For standard option, it's a flat $10 copay for a new pair of glasses every year. Your frames, you pay nothing for both high and standard option. And the way that this works is for high option, you're going to receive a $200 frame allowance. So your vision care is paid in full. So if you go to the eye doctor and you get your vision exam, you don't pay anything. And the doctor looks at, does that whole 1, 2, 1, 2, which one looks better. If you need glasses, you'll pay nothing for your lenses or your frames up to $200. So typically an optometrist or an ophthalmologist will take you to all of their frames and show you their collections. If that frame that you like is $180, then you pay absolutely nothing out of pocket. But let's say you want those Gucci frames, and those Gucci frames are $220. You'll get that $200 credit, and then you'll get 20% off the remaining $20. Now, we do give an additional $50 frame allowance at my eye doctor, so you'll get a larger incentive if you go to my eye doctor. And we do cover contact lenses and the evaluations as well. So if you need contacts, you don't pay anything for the evaluation or the follow-up. And then we do give an allowance for contact lenses. And we did increase the contact allowance up to $150 for high option and increased it to $140 for standard option. Here are vision premiums, very inexpensive. I mean, when you look at self-only, whether that being $11.96 for high option or standard option is only $7.65. If you need new glasses every year, that's going to cost at least $200. Your eye exam, typically an eye doctor will charge about $120 to $150 for your eye exam. And maybe when you get those glasses, you want to get UV coating on them. So the doctor charges you another $20 for that. All that is covered for either $12 a month or $7.50 a month. So you really do get a savings if you wear glasses or contacts. And 3 out of 4 people wear some type of corrective lenses. Now, you do enroll in dental and vision differently than your medical. Now, as you know, if you're happy with your plan just rolls over year after year. You don't need to re-enroll. Once you enroll in dental or vision, and you do that by calling Benefeds at the 877 number, or you can just go online to benefeds.com. You'll create your account, and then you just choose Blue Cross Blue Shield Dental and Vision, or either one, and they will enroll you. Your benefits start just as your medical does, January 1, and if you're happy with your plan, it continues to roll over year after year. Now, one of the things that here in Florida, I have 3 account managers, one in the northern part of the state, one in the central region, and one in the south. We are already attending local NARF meetings. I just went to the NARF chapter in Palm Coast this week. So we are out and about meeting all of our NARF members. But as you know, we also do a little road show where we travel throughout the state and we go over our health and wellness materials. You can take that home. You can have an in-person Q&A with Blue Cross Blue Shield representatives. We do presentations like we're doing now. You can also get a flu shot or a COVID booster, and we'll have vision screenings available as well. So on November 10th, we will be at UNF in Jacksonville. On November 11th, we'll be in Orange Park, Florida. November 15th, we'll be at the Marriott in Coral Springs. November 16th, we're going to be at the Villages, which is always our largest health fair. November 17th, we're going to be at Tampa in the Embassy Suites on West Shore Boulevard. And Friday, November 18th, we're going to be at the Altamont Springs Hilton. I mentioned our account managers. We have Omar Amador in the south, Jennifer Vender in the central region, and Houston Bowles in the north. Here is their contact information. So if you want to snap a picture with your phone, you can always reach out to them with questions, or if you want to set up a meeting throughout the year, you can do that through your account manager. Now, I mentioned that I am the son of a federal employee. That is me, and that's my parents. My dad started his federal career in the early 60s and retired, and they moved down to Palm Coast. So that is me and my parents. I live in St. Augustine, and they came up to visit. So that is my parents. And with that, I'll leave it up to questions, and Bill, however you'd like to moderate this or however you'd like me to handle it, I'd be glad to help.
Great. I would suggest that if you have any questions, you raise your hand or type in the side. Now, the first question got was Jerry, who was asking, do you have plans for Medicare? Or question,
right.
Have plans to offer Medicare Advantage?
Right. So I always laugh when I check my mail at this time of the year. It's always filled with brochures for either some type of an election or a $0 Medicare Advantage program. So as a federal employee, your federal plan was designed to be carried into retirement and paired with Medicare A and B. That is all that federal employees need is Medicare A and B in their federal plan. Now, there are some Medicare Advantage plans out there that are $0 premium. I would say just be careful with those. Some of those plans, if you leave your county, you do not have coverage. A lot of those plans, you need referrals. So where with your federal plan, you can just go to any doctor that you choose, obviously staying in network. With some of those Medicare Advantage plans, you do have to get a referral. And sometimes those plans, if you leave your county, you don't have any coverage with that. Now, the federal program does have some plans out there. Some of the other carriers that are part of the Federal Employee Health Benefits Program do offer Medicare Advantage plans. They are considered HMOs. When you look at the OPM website and you look at the premiums, a lot of those you can find those under the HMO. So that could be a limited network there. Remember, there is a cost. There are no plans in the Federal Employee Health Benefits Program that do not have a premium. So even the Medicare Advantage plans, you have to purchase the federal plan first. There's a question here, do I have to take Medicare Part B? So Medicare Part B is a choice. If you're heading towards age 65 in retirement, you have 3 months before your 65th birthday, the month of your 65th birthday, and then you have 3 months after your 65th birthday to choose Medicare Part B. There is a premium for Medicare Part B that you would pay. If you do not choose Medicare Part B at that time, the government will charge you a 10% penalty every single year you do not have Medicare Part B. So typically what we find is this. You're turning 65, you're in good health, you don't feel like Medicare Part B is something that you need at this time. Then all of a sudden, your health changes as you age, you're going to the doctor more, etc. Well, what ends up happening is if you choose to try and get Medicare Part B after your 65th birthday, you're not only going to pay the premium of Medicare Part B, but you're going to be required to pay that premium every year as well. So where Medicare Part B in 2023 may be $145, if you chose not to get Medicare Part B for 10 years, all those penalties add up. And 10 years later, when you decide you need Medicare Part B, it may be $320 a month. So it is recommended to get it when it's available, but that is a personal decision. So I'll scroll down here on some of the other questions. Let's see here. So that was the ramifications. How do I switch from standard to basic option during open season? The website, do I have to contact Medicare to switch? No, you do not have to contact Medicare to switch. You will have to contact OPM to switch your coverage. So typically, if you're an active employee, and you're working in a federal agency, you typically do that through your HR office, through a form called a 2809. Once you retire, OPM becomes your HR department, and they handle all of the switches. So if you're going to switch from standard to basic, OPM typically handles those switches for you. And they can do that during open season, which ends, I believe, either December 12th or December 14th. Another question here. Can you explain how Quest is handled in 2023? So there was an increase in lab work for our members. If you have Medicare Part A and B, there's no change. All that is covered. All your lab work is covered. This was specific change to individuals that their federal plan is primary. So if you're actively working, your federal plan is primary. Once you retire and choose Medicare A and B becomes primary and your federal plan becomes secondary. So if your federal plan is primary, even if, let's say, you're age 70 and you never chose Medicare A and B, your federal plan would be primary. So there was a change, which I can go over, for Quest on their labs. So instead of that being free, there now is a cost share, which let me bring up here. If I can move this. So there was a cost share change to 15% of the allowance. The good news is, so if you go into lab work such as a blood test, it's 15%, you're going to pay 15% of the allowance if your federal plan is primary. The average cost or the average allowance for lab work last year was $46. So it's no longer going to be free, but you're only going to pay 15%. And as I said, on average, it was about $46. So you're now going to pay on average about $5 for that Quest, as where it was free before. How do you get a 2023 booklet sent to your house? So the easiest way is to go onto FEHBP our website, and you click on brochures, and you can put in your address and they will ship one to your house. I can tell you that it is not, they're not shipping yet because the rates just got approved last month, so they're still printing those. But if you want to get a brochure, you can either stop by some of the events that I talked about, or you can go on to FEHBP You can search for brochures, and there's a button that says, I'd like a brochure mailed to me, and they will mail that directly to your house. See here, another question. How can I get copies of the slides? I think Bill is going to be posting this somewhere. I'm not sure if he's going to be posting that on the NARF website or where he's going to be posting that. He can go over that. I got a lot of questions here.
I plan on posting them to probably either the FedHub or a NARF website. And I'll let everybody know by email.
Perfect. So it looks like this whole presentation will be available to our folks. So that was the 2023 booklet. How do I switch? Do I have to take Medicare? The 15%. So if we have any active folks that are either active employees or folks that did not take Medicare A and B, I have your cost shares here on the screen, and I'll just sort of scroll through those as I answer these questions. Let's continue to go up here. Medicare. Ramifications, switching. Gym membership covered. So we do not offer silver sneakers under the Blue Cross Blue Shield plan, but we do have gym memberships and gym discounts. So if you're interested in, maybe joining a gym, if you go to our website at FEHBP we have a discount program called Blue 365. And that gives you some deep discounts on a number of things. So for instance, if you're interested in starting to work out and you needed some workout clothes, you can get discounts from Skechers for tennis shoes. You can get apparel and shoes from Reebok, but it also gives you the ability to look to see what types of gyms are available near you. It's part of our program called Tivity, Tivity. So if you live in Sarasota, you can go to our website under the discounts, find a gym. You'll type in either your zip code, or you can type in Sarasota, Florida, and it will show all of the gyms that are
Hey,
around
Robert, can you come here a second? I'm having, I want to leave, but I can't find it. It's not working right.
So if you have, if you're looking for a gym near you, like I said, you can type in Sarasota, or you can just type in your zip code. It'll populate all of the gyms. Now there is a monthly fee of $29, but here's what that monthly fee gives you. It gives you an ID card that allows you to go to all of the gyms that are around you. You just don't need to pick one. So if you want to go to 24-hour fitness on Monday and then anytime fitness on Wednesday, you can do that. It doesn't give you, limit you to one gym. You can see any gym that is in the network. Let's see, more questions are coming up. Let's see here. There is no cost for Quest if you have Medicare Part B. That's all covered in full. Access to the slides. Bill's going to do that. So chiropractic care is covered. Are X-rays and MRIs covered if chiropractor orders one? Yes, they are covered. If you have Medicare Part A and B, then you pay nothing for the MRI or X-rays. If you do not have Medicare A and B and your FEP plan is primary, this slide shows what your costs are. So for your X-rays, your CT scans, you're going to pay either 15% of the allowance or up to $100. So only up to $100 if it's an office, or if you're getting an X-ray done in a hospital, that's obviously going to be more expensive. You'll get up to $200 for that.
TJ.
Another question. Yes.
I have a question here directly from Joe Wheeler, sent to me directly.
Okay.
Do I need both FEHP and TRICARE for life?
Okay, so great point. So if you're retired, the way that sort of these plans fall in place is Medicare A and B is going to be primary. That's going to pick up 80%. Your federal plan is going to pick up the remaining 20%. So you'll have no out-of-pocket cost except for your prescription drugs. Medicare A and B is going to pay primary. FEP is going to pay secondary, and TRICARE is going to pay third. Typically, TRICARE does not get any bills because your medical plan under FEHB picks up the remaining 20%. I would say this, if your TRICARE plan, if you have TRICARE for life, and you're not paying anything for that, and there are some plans that you don't pay anything for, you can keep that. Now, if you're one of those people that has the TRICARE plan where you're paying a monthly fee, it's really up to you, because your plans are going to be covered at 100% with Medicare A and B in your federal plan. You may not need that TRICARE coverage, but I know a lot of people don't like to lose that. The important thing to know is your TRICARE coverage pays third. So there's typically not a lot that TRICARE plan is paying for. There's a question here from Clara Watkins. I don't have Part B and I use Quest Labs. I've always had a copay. Is there none this year? If you had Medicare Part B, there would not be any. If you have basic option, standard option, or Blue Focus, there is a cost. It's only 15% of the allowance. And like I said, Last year, the average allowance was about $46, which means there's going to be some lab work that you have done that is more expensive and some that is less expensive. But on average, it was about $46. And you're going to pay 15% of that $46, which probably equates to around $5. There's a question here about the Medicare. All that here. How do you get the $800 Medicare rebate if you join basic option with Medicare Part B? So there, if you go online to FEHBP there is a Medicare section on our FEHBP and I really do recommend that all of our members become familiar with FEHBP It's got a ton of information out there. What you'll do is you'll find the Medicare section. There will be a pop-up that shows Part B, Medicare B reimbursement. All you need to do is fill out the form, and you're going to send in, you can do that via email or fax, or you can even take a picture. Most people use their COLA statement. So your cost of living statement, if you pay your Part B premiums, that sort of shows everyone, that's sort of your receipt. And you're going to be asked to upload your COLA statement that shows your Part B premiums, and then your $800 will be sent directly to your house every year. Now, if you can't find your COLA statement or you don't pay it out of your allotment, let's say you just pay it by check or credit card, they can use that receipt as well to show that you paid your Part B premium. All they're wanting to do is just make sure that the $800 is going to those folks that have basic option and that also are paying that Part B premium. So I use benefits to sign up for Blue Cross Blue Shield. I currently have GEHA. Is the GEHA coverage automatically cancel your other plans? So yes, it will. So one of the benefits of having, let's say, Blue Cross Dental, if you have our medical, remember, when you go to the dentist office, you're supposed to show your medical card first and then your dental card. The reason being is most of the federal plans have some type of dental coverage in their medical, and that's going to pay first, and then your dental card picks up the rest. Well, if you have Blue Cross Blue Shield Medical and GEHA Dental, you may run into some problems every once in a while because the claim has to come from Blue Cross over to GEHA and then get paid. If you have Blue Cross Blue Shield Medical and Blue Cross Blue Shield Dental, sort of like the one hand knows what the other hand is doing, all the claims go directly to the same place, so there's never an issue with billing. Question being, if you have basic plan and you have Medicare A and B and you have to use a non-network provider, does the cost paid to that provider apply to your catastrophic limits? Yes, any costs go toward your out-of-pocket max. Your prescriptions, any costs are going to go towards your catastrophic limits. And your catastrophic limits are really there to protect you as an individual. So once you hit your catastrophic out-of-pocket max, your plan picks up all of the costs related to your health care. There was a question here, when can we submit for the Part B reimbursement? You could submit that any time throughout the year. I think your COLA statements typically come in January. So if you want to claim that in January, you can claim that. You can also claim for the prior year. So if you are one of those 18,000 that didn't claim their Part B Medicare reimbursement. You can claim for last year, you can claim for this year, and then in January, claim for 2023 as well.
Are there any more questions? If not, then I will thank TJ and thank you very much for this wonderful presentation and the gift of your valuable time.
Absolutely.
Go ahead.
No, I was just going to say, absolutely. You know, Bill, you and I have done this for a number of years, and it's always worked out well. I love how you make the recording available to individuals if they either missed or you know, they weren't able to see all of the presentation. That's very helpful. You know, we've always had a great you know, relationship with NARF. I was looking at some of our material that we hand out to all of our members. We even have a blurb about NARF on our materials. So we're trying to help you guys get increase your membership by letting individuals know about NARF. So, you know, it's a great relationship and we appreciate you.
Great. Thank you very much. And I will now cancel or end this meeting. Thank you very much and really appreciate everyone's attendance.